Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
I'm Dr. Ira Nash. Welcome to Well Said. Today we'll be discussing the importance of caring for caregivers. Specifically, we'll dive into how the pandemic has affected the well-being of healthcare workers and how health systems are responding to the increasing demands placed on their healthcare providers. My guests are my colleagues, Patricia Flynn and Dr. Jacqueline Moline. Patricia is the Assistant Vice President of Employee Wellness for Northwell Health, where she also oversees Northwell's Employee Assistance Program and Chaplaincy. Dr. Moline is Senior Vice President and Chair of the Department of Occupational Medicine, Epidemiology and Prevention, and is also a professor at the Donald and Barbara Zucker School of Medicine. She also chairs the Physician Wellbeing Committee of Northwell Health Physician Partners, and I'm delighted to have both of them on the show with me today. Pat, Jackie, welcome to Well Said.
Thanks for having me. Thank you, Ira.
So first, let me ask a personal question of the two of you, since we're talking about well-being. How are the two of you doing in light of what's been going on in the world these last 2 years?
You know, I find that over time, and I think it's probably something we're going to discuss a little later, is because I'm getting up there in years, I go with the flow a little more and have learned how to modify it and actually have found ways that instead of hating Zoom all the time, I actually find that it can be useful at times. But one thing that I have found is that I've tried to stay in contact with my colleagues and made a much more of a concerted effort for me to stay in touch with folks. And sometimes staying in touch doesn't mean physically seeing them because there may be barriers, but it could be reaching out phone calls, or it could be following new folks on Twitter and getting to know someone's voice in other means that I might not have absent the pandemic.
And Pat, how about you?
I think the connectiveness that we're seeing during the pandemic has been one of the positives. And, you know, I'm busy, concerned for my teammates and for my family. So I continue to look for ways to stay healthy and positive during this time.
Well, I think those are themes that I expect are going to come up during our conversation. Let's start with a term that's been in the news quite a bit, especially with regard to healthcare workers. That term is burnout. I wonder if we could start by having the two of you provide what you believe is meant by that term and whether you think it's something that is unique to healthcare workers or unique to the current circumstances. Pat, maybe you should start with that.
Yeah, I mean, with burnout, how we describe it is that, just the fatigue, loss of appetite, people calling in sick at work, some snarkiness among coworkers we've heard. So that's how it manifests in the workplace.
Jackie?
You know, I think we've all heard the term, someone's burnt out, and I'm sick of doing this, and I don't want to, and whether it's I'm sick of studying for my algebra test if you're a teenager, and I just can't do it to, I think our peak burnout happens around finals if you're a student. But when we think about healthcare provider burnout, there are descriptions of these terms. It's a syndrome that's due to prolonged stress, and there are some terms that have been used where people are depersonalized. They have a diminished sense of accomplishment, and they're cynical, or as Pat aptly said, snarky. But I think it becomes something that makes it hard for people to see what they are doing, what they're accomplishing, and how they fit into everything, because those feelings of emotional exhaustion overwhelm them.
So a sense of no longer being engaged in the underlying purpose of their work and just kind of mentally and physically exhausted. Do you think that captures?
I think that's probably a really good way of putting it. And I think we've all encountered folks who have reached that point. It may be that people have too much on their plate and they're just not able to concentrate. But the feelings of occupational burnout in the case of healthcare workers is where we see it. It may start with the workplace, but it could translate over into the home front. And that's where we're concerned about the effects on the whole body or on someone's entire life.
Yeah, the purpose part is very important, because to remind our healthcare workers of why did you get into this work in the first place? I mean, these are such wonderful, dedicated employees who, there's a lot of lack of control right now, uncertainty, just the chronic nature of this. So getting back to the purpose is really important.
Well, so that brings up an interesting question about the extent to which these kinds of stresses or these kinds of reactions to the stress preceded the pandemic. So is this something new with COVID, or has this been a problem for healthcare workers for a longer period of time?
It's been around for a long period of time, and it feels like it's gotten worse over time. I think that if we look at a variety of different surveys, it's certainly worsened over the past, I would say, 20 years. And there are a number of factors. For healthcare, the days never ended at the same time as necessarily a 9-to-5 job, but there's the expectation of always being available, not just when you're on call, but you're always on call. I think there's been dissatisfaction with the way in healthcare in particular, the documentation has overtaken many people's lives in terms of the amount of time it takes, whether you're a medical assistant or you're a nurse or you're a physician, and how that can impact. But it's certainly preceded the pandemic. I think it's been heightened by the pandemic, by some of the unique stressors that didn't exist in an everyday situation prior to the pandemic.
So, Pat, is that your experience too, that it's always been kind of a tough job and it's just gotten tougher?
Yes, I was going to say that. I think it's not new. I think the stressors are changing. But one thing that always strikes me is that we attract people that are pretty resilient. We attract people that can adapt and be flexible. So there's that piece of it too that's pretty positive and wonderful. But it's been stressful. And I know Dr. Moline was involved in 9/11. I would love to see, how has it changed since then, even, in terms of the stressors at work.
Jackie, you want to address that?
Yeah, I think one of the unique factors after 9/11 was a sense of coherence and a sense of unity, that everyone felt that they were in for a common good. And whether it was workers on the piles or the volunteers or the people who were bringing down clothes and socks for everyone who wasn't leaving the pile, to people lining up to give blood in case it was needed, it was a whole community effort. And you had that sense of togetherness. Over time, that's dissipated. I think in general, as societies become a bit more polarized. But you look at the folks who were amazingly resilient, and after 9/11, many of the first responders are amazingly resilient folks. Mm-hmm. But many of them did have burnout as well after that. We don't necessarily focus as much on that.
Yeah, so that brings up an interesting question about whether this is a phenomenon that is particular to or unique to healthcare workers, or whether burnout and work-related stress, let's say as in response to the pandemic, is a broader issue. I mean, yes, I think we would all agree that nurses on the front lines, doctors on the front lines are facing a difficult challenge, but I think people could argue that so are school teachers, so are transit workers, so are food delivery guys. Is there something different about what healthcare workers are experiencing, or are we just focusing on one slice of a much larger problem?
I think there are a variety of reasons why it's become an issue more in the healthcare field, because how burnout can affect patients. There might be more patient errors. There may be more requiring folks to step up. There can be adverse outcomes to having burnt out healthcare workers. The ramifications of burnout may be more significant than in whether someone is in other professions where it isn't a life and death situation all the time. But I do think that we've seen burnout in many different professions, and many of those have been highlighted. All the essential workers or those deemed essential workers, I think, have experienced varying degrees of burnout through the course of the past 2 years.
Yeah, one thing that I've noticed is that what's common to all of these is more family involvement. I've heard more over the last 2 years about concerns for, especially because of the schools, the remote learning. People are very concerned about their children and their families. Not that they weren't before, but I feel that has been heightened over the last year. That's what we hear in employee assistance, more under 16-year-old patients than we usually have.
So it's not just the stress and the challenge that they're facing at work, but it's compounded by worry about their families, concerned about child care, financial issues at home, all of those other things.
And it's the disruption of the normal day-to-day. I mean, if kids are learning at school, and I think that's been borne out where you have teachers saying it's just so hard to engage our kids again in a classroom because for the past year and a half, they've been engaged with a device. And that's been their lifeline. And now we're asking them to give up their lifeline, to go back to traditional in-classroom teaching where those kids are having challenges in that standpoint too. And it is, I guess you could call that burnout as well. And then for the teachers who are being asked to do more and more, there's certainly elements of burnout.
So that kind of anticipates where I was going to go next, which is asking you to provide insights into whether there are certain groups of individuals within this larger heading of healthcare workers who are more likely than others to be feeling those stresses and having it affect their work. So we talked about parents of young children who may be concerned about what's going on with them. Are there other kind of demographic or personal characteristics that mark somebody as being at higher risk for having burnout?
It seems counterintuitive, but the older folks tend to have less burnout than the younger folks. And people just coming into the fields tend to express more burnout. And we see that when we look at medical students, and we see that at residents who have some of the highest rates of burnout, particularly residents who work very long duty hours and have a number, they're in a learning environment. There are a lot of people they have to please all the time. And it's a very challenging environment for everyone. Add that to the additional stress of what's happening with the pandemic, and that can push people over. I think another demographic has been women have been more affected than men, and this tends to be women in their 30s, 40s. And again, that may be reflected by the nature of the pandemic with the increased child care responsibilities or the kids home from school, as well as the worry about that you're bringing your work home and there's a potential of danger to your family. And that cuts across not just doctors, but also nurses and medical assistants and anyone who is in the medical field. For our environmental services folks who are cleaning the rooms, who are essential, and they're at increased risk as well. Yes. So all these folks who may be in that age group have been shown to be at increased risk. And then there's certain specialties within medicine that the rates of burnout have gone up pretty dramatically over the course of the past 2 years. And that's folks in the emergency department,
yes.
Intensive care units, yes. The primary care has been, I think, probably the groups that have been affected the most.
Pat, anything you want to add to that?
Yeah, one interesting thing that we found out was that 70% of everyone, polled is doing caregiving in addition to their work caregiving. So that's children, but elderly. And disabled family members. So that was a huge finding for us in terms of how to support them legally, financially, socially, just in all those different ways. It's been a big finding for us about the pandemic.
Yeah. Jackie, you mentioned something really interesting a couple of minutes ago, which I think is part of the answer to the question I'm about to ask, but I'm going to ask it anyway, which is, if this is something that is broader than healthcare workers, why should the people listening to us right now really care that this is affecting healthcare workers as much as, or maybe more than, a lot of other people? I mean, are we just kind of focusing on this because we're in this profession, or are there implications for everybody that this is a problem in the healthcare workforce?
Well, I think if it becomes a problem in the healthcare workforce, then who are you going to go to when you're sick? Are you going to have enough people to staff the emergency department if you come in, if you get hit by a car? I mean, are there folks who are going to be able to provide the most compassionate, high-quality care that people have come to deserve? And for our society to function, we need an active, robust, and a healthy and emotionally healthy healthcare sector. It's also a large part of our economy. But apart from that element of it, it's not something we can do without. There are certain luxuries we might be able to do without. But at some point, folks are going to need to know that their health care is in place and present, and hopefully that their providers are in place and are present and are not only physically present, but emotionally present when they go in and see them. So I think those, while we don't want to see burnout in any occupation, I think that's why it's come to the forefront. Particularly, the pandemic has highlighted it in many ways, because people are just being overrun in many hospitals throughout the country, where there just aren't enough staff to cover the amount of people that just keep coming in needing care.
Yeah,
and I love, Jackie, that you brought up compassion, because I think it's really a two-way street. And any patient that goes to a hospital or a doctor wants compassion, but we're looking for them to think that these are people with families and all too, our healthcare providers. It's just so important.
I'm glad you brought that up, Pat, this idea of having compassion for the healthcare workforce is important so that they're able to take care of us in our times of need. Thinking back to the early days of the pandemic, when I think a lot of people were very overt in their appreciation of the healthcare workforce. There are all these signs up outside of hospitals, "Thank you, healthcare heroes." People in Manhattan were banging on pots every day at 7 o'clock, and the fire department was hanging big flags from hospitals as a sign of appreciation. Now, it doesn't feel that way anymore. And is this just the passage of time, or what happened here? Why are people not showing healthcare workers the same love that they showed them in April of 2020?
I think because in April of 2020, the hospitals were the last, that was the only place people could go for the care. And that was the only treatment available for the people who were overwhelmingly sick with this new infectious agent, or new with the COVID-19. People saw that healthcare workers were putting in those extra hours. They were expanding their facilities. They were doing everything they could, and at tremendous sacrifice with, the deaths of, 3,500 or so healthcare workers died very early on, or that may be a number for physicians, died early in the pandemic caring for folks. And I think as there have been more treatments, and there has been more with the advent of the vaccine as something that's available that some people have chosen not to partake in, that has led to a polarization within our society. And actually, it's not just in the U.S. It's in many parts of the world. There's a similar denial of the virus as a cause of many of the maladies affected from the virus, and people believing it's a hoax. And if you believe something is a hoax, then you're not going to have respect for the people who are trying to treat the hoax, because in your mind it doesn't exist and it has to be something else, and you don't want to be told something that isn't in your belief.
So let me follow up on that, because I think that's really interesting, but there's also a flip side to it, which is you mentioned the vaccines. I've been saying on this show over and over again at every opportunity that I get that the evidence is overwhelming that these vaccines are safe and effective, and they're the best way that individuals have to protect themselves, their loved ones, and their communities. But sadly, that somehow is still a controversial statement, despite how well supported it is by a mountain of facts. And so there are people in our society who have chosen not to be vaccinated, and they are now making up the bulk of the people who are getting sick enough to need care in our hospitals. And I wonder to what extent you think that the fact that our healthcare workers are taking care of people who they feel like made a bad choice is affecting their sense of professional obligation or professional well-being. Maybe, Pat, you can address that first, and then I hear from Jack as well.
Definitely hearing resentment, from the front line of people who they're caring for who are not vaccinated. But then I think the healthcare workers are so professional that the care is not going to be, compromised in any way. But we've heard resentment in that sense.
But I think to that point, the resentment becomes internalized, because you still have to go about providing that same quality, compassionate care, even though someone is denying they have COVID. Their family members are screaming they couldn't possibly have COVID. They're demanding medications that have scientifically been proven not to be effective because they believe that they would be effective for their loved ones. And that's going against a physician or a healthcare worker's ethical beliefs. And I think that is leading to more of a challenge and more compassion fatigue, more emotional exhaustion, because you're not just fighting and working hard to care for the people. You're fighting people who are fighting against you in believing what you're trying to do to help them. Yeah. So it's an extra burden. And I think it's becoming internalized because you're still going to take care of them. I think that's one of the highlights, where when you ask the difference between healthcare workers and other essential workers, the healthcare workers are still going to stay on that job and still take care of that last patient, even if that person is screaming at them and saying this isn't the case. They're still going to provide the best care they can.
So I know that our organization and many others are offering an array of programs and services intended to address the challenges that we've been talking about. Before we get to that, I want to ask a different question, which is for the people who are around the people we're talking about, the loved ones of our healthcare workers. What should we be telling them about what to look for, what to be concerned about, and when to intervene in the lives of the healthcare worker who may be in the state of burnout that we've been talking about?
I think when someone isn't acting like themselves, everyone has a bad day and they may not want to discuss it. But when that bad day becomes a bad week and they start disengaging from activities that they normally would do around the house, then it's time to really not let that continue to build up and allow that person to just say, oh, it's just too stressful at work, I don't want to talk about it. They may not want to talk to you about it as a family member, but perhaps they want to talk to a colleague or a faith leader or professional help. And I think that's when we need to really look to see if there are changes in people just aren't interested. People used to be an avid exerciser, and they just stopped doing that. Or they love to read and they stop doing whatever it might be that you're seeing the changes. I think you need to see if you can intervene in some way, whatever works for the different folks, and everyone is going to be different.
Yeah, and just to keep the conversation going, to ask them, especially like with your coworkers, how are you doing? Both family members and coworkers, just ask. But the listlessness, the fatigue, the not sleeping, anger, and those are all the signs.
Let's get back to what we can do about it. So, Pat, maybe you can start with giving us a brief rundown of what kinds of programs in general are organizations like ours doing to support and folks who are feeling this way?
There's really so many different resources that companies like ours are offering, and it's everything from the low end of mental health, like a breathing exercise or yoga, all the way to really helping them navigate provider care in mental health. We have one-to-ones, we have workshops, there are all different types of tools. One of the things that I think was very helpful, we did a lot of recognition of employees. We did surveys asking folks what they wanted. I think one of the most popular things, sounds strange, but the memorials that we did, even just not so much the big ones, but department memorials when a department lost someone. But the resources are there. It's the team you're on, the culture you're living within at work. Is your leader giving permission to maybe, make sure you're taking your PTO day. Make sure you take a break. So it's a whole surround sound of culture that's going to support this. It's not one thing. And each company, each hospital knows their own culture best and can help partner, to provide the best resources. And, I've really seen that the stigma has lowered. People are asking for care. People are asking for help. We had a higher rate of EAP, clients over the past 2 years. So that's getting better.
Jackie?
I think, for physicians who are traditionally fairly reticent to seek out care, I think there's thinking about peer-to-peer counseling or reaching out, and maybe it's to someone you went to medical school with or you did your residency with. And this goes for anyone in any profession, so it isn't just unique to physicians, but make sure that there is a recognition if someone is just not seeming right, that you suggest, hey, why don't you reach out to somebody? Or is there somebody that I can help facilitate that reach out for? And it's not necessarily saying you need a mental health professional. In some cases, that will be the right move, but it may just be make sure that there's a connection. We have programs that have been started at our organization, Stress First Aid, for example. And one of the beauties of that is people can learn where they are in their continuum of stress. So am I having a green day, which is a lower stress day? And then if I'm moving up the color coding to orange, to yellow and orange, and then all the way to red, which is the highest, when I'm beginning to feel like I'm transitioning and recognizing, that's when I know I need to maybe reach out to take that PTO day, or I need to reach out to that person. But to normalize that and allow team members to say, hey, you don't seem like, how are you doing today? Are you orange? You seem like you're not doing as well as you were today. Did something happen in the exam room? Do you want to talk about it? Is there someone that I can put you in touch with? I think the reach outs are really, and the connectiveness is the way that we can really help each other.
Yeah, one thing that we're hearing is that people are just looking for a little support. If their leader walks around the floor, we've heard some, and the direct outreach, as you're saying, Jackie, but that Stress First Aid does offer a wonderful language, like you're saying, for everyone. Who's green, who's red, and what are the potential services that are offered. we've heard so much about, people are concerned about their personal chronic conditions too, more than ever in my career of wellness. So the diabetes, the hypertension that someone has, combined with potentially, having the virus, is a concern. So people are looking for services in all those areas. Nutrition was one of the most popular topics that we were asked about. Sleep, nutrition, families, some of the top concerns.
Well, this has been fascinating. I want to close by just asking you if there are publicly available resources outside of a large institution like ours where people can get more information or get help if they feel like they need it. Anything out there that you want to highlight?
You could just Google healthcare worker burnout, and there are a lot of tools out there that will put you in touch with resources. Professional organizations are certainly have recognized this and do have the tools, whatever the organization might be, whether you're in the first responder community, whether you're in the healthcare community, these resources are out there. I think it's important to recognize that there are resources out there for everyone, and that people aren't alone in this. That's a very common and unfortunately pervasive feeling right now.
Pat will give you the last word.
I think the caretaking resources that are out there are so critical. And last word on that, the financial counseling. We're hearing so much of that. So lots of free resources and connection out there, social connection.
Look, I want to thank you both for a really interesting conversation about an important and not often discussed topic. Thanks very much to my guests today, Patricia Flynn and Dr. Jacqueline Moline, for joining me to discuss healthcare provider burnout. For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.